Hi, I'm Dr. Rich. I'm teaching you about dentistry and teeth so you can have a very nice smile.
Thanks for joining me. A patient came in recently with a really loose lower molar. It's wiggling all around, bothering him every time he eats, so he wanted it extracted. So I said, sure. First thing I'm going to do, I'm going to get a little bit of topical anesthetic on a Q-tip, pina colada flavor, of course, and we're going to put that way back in the back of his mouth, right where I'm going to inject him with the syringe. Next, I get the syringe ready. For lower blocks, I like to use a 27 gauge long needle, as you can see. And I'm going to use a carpule of 4% articaine. This is so much better than the older lidocaine that we used to use. It lasts longer, gets the person number faster and more profoundly. So here we are injecting. I'm getting the needle in the right spot till I get it, and then I'm going to pull back, make sure there's no blood in the syringe, and then I'm going to deliver the anesthetic. I'm going to go nice and slow, not too fast. You don't want to just jab it in. And then I'm going to give a little bit on the side of the tooth. This is to get the long buccal nerve. Once the tooth's numb, I take my spoon excavator and I just feel around the tooth between the tooth and the gums to make sure the tooth is numb. Reality is the tooth was so numb I could probably have removed it with that, but I'm going to use my trusty cow horns instead. So I'm just going to grab them, wiggle the tooth out, and it's just going to pop right out. I mean, there's not much holding it in. There it is. A little messy. Let's clean it up. But first, I'm going to take some gauze, fold it up, have the person bite down on it, and here's a close-up of the tooth. Two rooted lower molar. Let's get rid of some of that blood. That's kind of yucky. I'm sure YouTube's going to flag me for this, limit my ads, but that's okay. It's kind of cool to show you guys this. So it's two rooted molar. And it's got an old silver filling on it. And right there, if you look close, there's a little divot there in the silver filling. That's because the patient used to have a lower partial denture and it sat down on this. And then over here on the side of the tooth, there's a hole there. There was another silver filling here that the patient lost at some point. And then lastly, you could just see how worn away this tooth is on that side. That's the mesial side. And then a little bit of plaque on the back side of it, on the lingual. All right, so he's been sitting a while, he's clotted up. Let's take out that first gauze that I put in there. Okay, looks good. And let's put a fresh piece of gauze in, and he's ready to go home. Thank you guys all so much for watching. See you in the next one.